everyone. We're going to crack on with today's lecture today, or today's workshop rather, right? And today we're doing assessments and programming, right, guys? Today is going to be a little bit of a long one. We're going to try and get through it ASAP, right? That will also be based on your guys' interaction and if I think that we've grasped the topics, and then we can crack on. All right, cool beans, lemon squeeze. Right, we're going to start off today with screening and resting assessments. Here we're looking at heart rate, blood pressure, posture, body composition. Right, it is incredibly important that we understand these, where they interject, why is it important to know them, and what do we want to get out of them, really? I mean, like, of course, when you look at something like heart rate, you think, well, cool, Cameron. I mean, we're just going to be getting, how fast their heart beats or whatever the case may be. But the net result of heart rate to blood pressure is so important because many people actually don't know that they live with high blood pressure. And high blood pressure is the silent killer. Can anyone tell me why?
Your heart's working overtime initially.
Okay, true, correct. But why would I say that it's silent? Like why that?
There's no physical symptoms.
There we go. You don't know that you have it. You can be here. Yes, maybe you can feel that you have a high heart rate, but high blood pressure, though, you're not going to know that you have it unless you measure, right? So if you are someone who is struggling with your health and whatnot, I can guarantee you one of the biggest detriments to long-term health is high blood pressure. Okay? And it's so difficult to diagnose just at face value unless you measure, right? Because if you don't measure, how are you going to know? Right? Cool? Everyone in agreement? So, and then we need posture, guys, right? If you think of how you're building it, you need to know what's their heart, health like, right? So from a heart rate to blood pressure, we then want to see their posture, like what changes potentially need to be made. Now, when you're going to tell someone, we'll get into it now, but when you say posture assessments, don't tell them that you're going to be doing a posture assessment, because if I tell you, okay, hey, Wakil, or hey, Precious, or hey, Philia, or whatever, right? I'm going to be doing a posture assessment on you, right? All of a sudden, you're going to be like, okay, awesome, right? Shoulders back, upright. You're going to mimic what you think I want to see. And what I really want to see is how poor your posture really is, right? What imbalances do you really have in your posture? And that's one thing also, if you look at like ladies specifically, how many of you guys use a handbag? All right. Now, a lot of the time, you normally have a preferred shoulder, right? Or maybe if you're walking with someone, maybe you keep it in the side that maybe you're holding hands with or whatnot, so it's in the middle, no one can take it or whatever the case may be. But if you use a specific side, even if you look at children at school, maybe Robert has noticed or whatever the case may be, right? Remember, like when you're at school, you want to look cool, like you don't want to be one of those. So you want to one strap it, and you have mom and dad saying, no, you use both straps, like the bag is designed for this. And it's just, no, I'm a cool dude or a cool girl, and I just want to one strap it, Meanwhile, they have half of the library in their backpack, right? And they're there, and it's like they're like one of the seven dwarves walking to work, and it's just like holding down. If you had to do a posture assessment on that child, you probably realize that over time that they're actually like this from their shoulder point of view, because they're so used to their shoulder being like this. Now, if I tell that child, right, I'm going to be doing a posture assessment, all of a sudden that child's going to be like, right, yep, shoulders back, as if you're in the army and you're getting checked, right? So you have to be very straightforward, right? Hey, please can you just stand against that wall? Okay, cool. Next. And then body composition. Now, as we go on with all of this, guys, the biggest thing that I'll say that comes before testing is consent and enabling that you are in a comfortable environment. right? Whether you're going to be doing this at a gym or at a high performance center or whatever, 9 times out of 10, there are physio or biokinetics rooms or whatever the case may be where you can do these assessments. Agreed? Now, if you have these places, now let's just say any individual, right? Any gender, right? I highly doubt someone wants to be quote unquote stripping down, right? Because some of these assessments, you do need to get a blood pressure cuff. You can't just have a jacket on. Or if you're going to do some posture assessments, you are going to need an element of a visual of their physique, right? You can't just be wearing a tracksuit and a puffer jacket like you're going to be hiking to Santa at the North Pole, right? The point being is that you're going to need a basic understanding of what their body looks like to see where their imbalances are for you to be able to have an adequate assessment. Now, the assessment is not above being a decent human being, and B, how comfortable they feel in that situation. Specifically, if you are a male and you are testing a female. If she is not comfortable, for example, to wear tights or a sports bra or something where you can adequately see their physique, right? Or even a male, if he's not comfortable, regardless of whatever reason, maybe they feel insecure about how they look or whatever the case may be, and they are not comfortable to maybe take off their top or whatever the case may be, that is fine. Okay? That is fine. The test does not supersede how comfortable your client feels. Because if your client doesn't feel comfortable and then you push for that, then like, why is this individual going to work with you then? You clearly have shown no regard, no understanding for their privacy and for how they feel. Now, granted, there's levels to this in the sense that if you are a bodybuilding prep coach, right? And your job and your client wants to compete, and your job is critiquing their physique. Well, I mean, heck. I mean, if you're asking me to prep you for a show where you're going to go and stand on stage in trunks or a bikini or you're posing tights or whatever the case is going to be, you are by default asking me to critique your physique in that condition. So we can't necessarily be playing around here with tracksuit pants and long sleeve tops and all of that, right? Because, you know, the position that I'm in or the coach is in is very different to what you're asking me to do. So are we in agreement with that, right? But if you look at your general population clients, when they come to you for assessments or you're doing check-ins or you're checking health or whatever the case may be, right? If they don't feel comfortable or there's not the space available at that moment in time to do an assessment, just crack on. There's a million other ways that, and you'll see, there's a million other ways in which you can test someone in a manner which 9 times out of 10, they're probably going to feel more comfortable with than that. And also a special mention to the males here, right? I don't care how good you think you are as a coach. I don't care how important you may think a test may be. If you're working with a lady and she does not feel comfortable to do some form of testing, or she does not feel comfortable to, whatever reason, wear certain elements of clothing or wear tights or feel comfortable you doing a posture assessment with her, don't do it. Don't do it. It is that easy. It is literally that simple. They say, look, I'm not uncomfortable. No. No means no, China. Just move on. Just move on. And that goes for anyone. Anyone. It doesn't just have to be a male coach with a female client or whatever. It goes every single way you can imagine, right? But no means no. But specifically in that, no amount of sweet talking, no amount of flirtatious banter, nothing. If she feels uncomfortable, no means no. And we all just keep that as a baseline, which I'm sure we all will. Cool. Now, when we look at, can everyone see the next slide? Can everyone see heart rate here? Right?
Yeah.
Guys, you don't have to read this. I'll read it for you. You guys are going to get the recording, so don't stress, right? I just want you guys to focus. And if you have any questions, please, or anything, just raise your hand. Right. Heart rate. Before you measure resting heart rate, your client should rest for 5 to 10 minutes in a supine or seated position. The following are pointers for accurate heart rate readings. Very important that they are sitting in the supine position, right? You want them to sit, right? Reason being is because you also want to try and get the arm in as neutral point as possible, right? You want to try and get the body relaxed, right? If, let's say, your client is arriving for these assessments and they've just been in traffic, a taxi's cut them off, they've just flipped them off, they've just told them how I met your mother, etc., 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 and they've got into the gym, they know that they're late, they've quickly changed, and they come in and they're like gasping for air. Why are we going to measure heart rate right there and then? It's of course going to be skewed. It's going to be elevated, right? Because you're not doing it in a quote unquote relaxed environment, right? Let them calm down a bit, chat to them, let them have a little bit of water, and then measure, right? Fair enough, because majority of the day, they're probably going to be at that resting rate, right? They're not going to be like, all upset and whatever the case may be. Now, resting heart rate may be measured directly by placing the fingertips on a pulse site, also known as palpitation, or directly by listening through a stethoscope, also known as oscillation, right? Resting heart rate should be taken first thing in the morning, sitting, not lying down on 3 consecutive days, and an average reading obtained. Resting heart rate may be taken for a full minute or for 30 seconds, and the reading multiplied by 2. In emergency settings, you can take the reading for 15 seconds and multiply it by 4. Right? Reason being is because you're not going to wait a minute. If you can tell already that their heart rate is low, you want to administer some form of first aid and not wait another 45 seconds. Right? But that's in that case. Does anyone know how to do those things? Has anyone tried to do them? This is the only unfortunate thing of when you do it online. But if we were in person, I'd be teaching you guys to do this on each other, right? But the good old 2 fingers, right? Please don't use the thumb. Why? The thumb has a pulse of its own. Multiply what by 4? Well, Melo, if you're measuring, you're going to read for a minute, right? So you're either going to measure a full 60 seconds, or you're going to measure for 30 seconds and times it by 2. Or like I said, if you measure for 15 seconds, then you're going to multiply it by 4, because 15 by 4 gives you 60. Is everyone in a understanding of that? Right? Now, the most common points is here, right? You're going to try and go for around the neck, right? And you can do that now, right? I'm pretty sure we all have partners which has maybe frustrated us before, and you have those comedy shows where either the girlfriend or the boyfriend or the wife or the husband will wake up in the morning and just check that their partner's still alive. I'm like, damn it. Nah, I'm just kidding. But the point being, right, it's over here, right? You can use the wrist. It is a little bit more tricky to find, right? Because everyone has slightly different, depends muscularity of your wrist and your ability. But all of us, like if you were to take your 2 right fingers and you just place it on your wrist, see if you can find your pulse. Like if you place it on your wrist, your neck may be slightly more difficult to find while you're sitting there. I do believe I am alive. Cool. Now, guys, the only way you're going to get better at this is practice, right? So if you are going to start working with clients, or that's your intention, please practice on your loved ones at home. Or if you work in the office space, just grab a colleague or 2 and just be like, listen, what's your heart rate? And no, yes, you can use Apple Watch, you can use Garmin, you can use all of these cool things, but you also have to practice doing it for yourself, right? Because we'd rather be safe than sorry, rather measure twice. It's like pretending you're baking a cake. You're just going to do it with your eyes, which I'm sure a lot of people do. But if we want to follow the recipe to the point, you're going to measure. Now, resting heart rate is accurately measured by placing the tips of the index and middle fingers over the radial artery and the wrist, which we just discussed. Exercise heart rate is most accurately measured by applying light pressure to the carotid artery. Why? Because the baroreceptors in the carotid artery respond to pressure by slowing the heart rate. Exercise heart rate should be taken for 10 seconds, with the first count being 0. When measuring exercise heart rate by oscillation, the bell of the stethoscope should be placed over the third intercostal space to the left of the sternum. Another method of measuring heart rate is by means of a portable heart rate monitor. This consists of electrodes which are strapped to the chest, which pick up the heartbeat and transmit to a digital receiver. Right? Not all of us are going to be working in a high-performance center. Not all of us are going to strap our clients up like they're Captain America, right? And doing tests on him like that. But the point being is that there's various different ways. The good old way is just use your fingers, right? But now it's going to be very difficult if you're trying to test heart rates on your client while they're running. What you're going to do, like run behind them and like put your finger by their neck and you're going to be running, and no, right? There it's slightly different, right? But for you guys, if you're just working with general population clients, you just want to see what's their resting heart rate like. You know, and that genuinely is very much, it can also be career related. I mean, like if you look at like these big corporate execs and whatnot, people who have a lot of pressure, or maybe day-to-day individuals, there's a lot of people who work 2, 3, 4 jobs, right, at a given time, right? If there's a high element of stress, they're probably bound to have elevated heart rates. Right? Because they're doing so much, their hearts need to just pump more blood, more blood, more blood, more blood, right? And that's just the name of the game, you know? But yeah, there's various different ways you can measure. Does anyone here have a stethoscope? Has anyone used a stethoscope? There are kits, I'm not sure if they still do sell them, but there are kits that you can get from HFPA that have all of the equipment that you will need for testing. But I'm not sure if they still have them or not. But ask your tutors and see. And maybe they'll be able to assist you. Cool beans. Everyone happy with heart rate? We can move on to blood pressure. Blood pressure, also known as BP, and the routine method of measuring blood pressure. Okay, but that is in your first year book. Okay, blood pressure is the pressure created in the arteries when the heart pumps blood to the body. Blood pressure is in millimeters of mercury, which is mm capital Hg. Systolic pressure, the upper reading, represents the pressure created in the blood vessels as the heart contracts. This is the maximum pressure created by the heart during a complete cardiac cycle. Diastolic pressure, the lower reading, represents the pressure remaining in the arteries between contractions, for example, during the filling phase of the cardiac cycle. This is the minimum pressure within the arteries during a complete cardiac cycle. Everyone understand? Top number, bottom number. All right? Now, blood pressure of 120 over 80 millimeters mercury is considered normal. Systolic hypertension is diagnosed when the systolic measurement is 140 or greater on 2 or more separate occasions. Similarly, diastolic hypertension is diagnosed when the diastolic blood measurement is equal or greater than 90 millimeters mercury on 2 or more separate occasions. All right? Now, the method, the gold standard for assessing blood pressure is the direct measurement of intra-arterial blood pressure, right? In the field setting, however, blood pressure is typically measured indirectly by oscillation using a stethoscope and a sphygmomanometer. Yeah, I struggle to pronounce that. I just call it a blood pressure cuff, hey guys. But you guys, I'm not sure if you need to know how to spell that. So, sphygmomanometer. Okay.
Yeah.
Sphygmomanometer, right? Consisting of a blood pressure cuff and aneroid or mercury meter, right? Since stress can elevate blood pressure, measurements should be taken in quiet, comfortable surroundings to ensure a reasonable estimate of resting blood pressure. Clients should sit quietly for at least 5 minutes before his or her blood pressure is taken. The client is seated, and the routine method for measuring blood pressure uses a sphygmomanometer and stethoscope. The client's arm should be rested on a table so that it is at the level of the heart. Why? Why are we not going to measure blood pressure with my arm in the air?
Because the blood will be pumping downwards.
You're going to get an incorrect reading because all that pressure is going to be flowing back towards the heart, putting pressure. You're going to get an incorrect reading. Okay, kind of want to have it level. So that's why, when you go to the doctor, they like hold your arm out like this, almost like you in Harry Potter and Voldemort's asking for your wand, like, bring it to me, right? So the point being, right, is, you got to measure accurately. You got to make sure that you know what you're doing. These two tests, blood pressure and heart rate, can be done within a month, literally, right? Let them come in, let them be nice, cool, calm, collected, ready to rock and roll. And you can get these done within the first minute or two, right? Now, it is going to be incredibly difficult for you guys to do this if you have never practiced. Why? Because as you see what we're going to do now with regards to how you measure, you have to hear, right? So what you're going to do, you're going to pump it up nice and tight, right? Then you're going to slowly, on the little bezel, release the pressure, right? Open it too much, and it's just going to go, psh, and you're not going to be able to hear anything. Open it too little, you're going to be standing there for 5 minutes. So you need to find that nice little, pressure release. And what's going to end up happening is that you're going to hear a couple of sounds. So it's going to be quiet, and you're going to hear doof doof. That is the first sound. That first sound is going to be your top number. That's systolic, right? Then as you go, it's going to go doof, 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 doof. Then you're going to hear one last doof, doof. And it's just going to go tss. Right? That last sound is going to be your diastolic pressure. Does that make sense? So you're going to have your upper number and your lower number. But you have to practice, because if you don't know what you're listening for, you're just going to assume. Can you, if you have a very keen eye, yes, you can see that big, because it goes doof, doof, and then doof, 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 and then the last little doof, doof, doof. Right? You can effectively see that. But unless you know what you're looking for, unless you know what you're listening for, it's going to be very, very difficult. Right? And you don't want to give an incorrect reading, because you kind of need to know what their blood pressure is at, Now, granted, if they're taking other medications, if they're on anything else, granted, there will be some, effects potentially on their blood pressure. But again, you're not a qualified technician or clinician in that sense. So you're not there to look at what they've spent at Dis-Chem and diagnose. But the point being is that you just need to get yourself in the ballpark, right? Because if someone has a blood pressure of 150 over 95, right? Are you going to go and make that person run a kilometer? I mean, you could. It may not necessarily give you the output that you're looking for, right? Or if someone has low blood pressure, you may think to yourself, okay, they have low blood pressure. Is that clinically diagnosed? Maybe they have been diagnosed with low blood pressure. Maybe then you understand, right? Probably going to need to spend a little bit more time warming them up. So it may take them slightly longer to warm up. Not going to be the same as your client that has maybe more normal or slightly elevated blood pressure that feels warm and ready to go in a couple minutes, where this individual may take 10 to 15 minutes to feel warm. Do you see what I mean? It's not just necessarily health, but it's like, how can you apply what you have learned to your coaching practice. Does everyone agree? All right. Does anyone have any questions so far? You guys have been awfully quiet today. Or we just here for the vibes, or we just here to crack on. Cameron, I just want to crack on. Thank you so much. I just want to listen, take in the information, and I got a bri at 1 o'clock. I really need to wrap this up so we can crack on. Okay. Fear not, guys. I'm also a little bit nervous for today. I unfortunately support the Sharks, and I unfortunately also support Liverpool. So by hook or by crook, weekends have not been the best for me. So spare a thought for fellow Sharks fans out there. Right. Right. Now, blood pressure. The cuff of this device is placed around the arm above the level of the elbow, as we previously mentioned. As it is pumped into the cuff, pressure is directed inward, compressing the brachial artery. A stethoscope is placed over the artery, about 1 centimeter superior and medial to the antecubital fossa. Do we know what that means? Superior, up, medial, towards the middle. So up, medial. Right, cool. And it is slowly released from the cuff at the point where the blood pressure exceeds the cuff pressure. The first sound is heard. This is the systolic pressure, and the sound is produced by blood forcing open and compressing artery. As more air is released, the sound becomes fainter. Diastolic pressure is read when the sound disappears. Right, you see cuff, artery, sphygmomanometer, stethoscope. Now, what's pretty cool in the set that back in the day, because I'm so incredibly old, back in the day when I was at HFPA, we got given a set with the stethoscope already attached inside. Right, so you also do get those sets where you don't have to try and place the stethoscope in the right place and all of those good things. So there are ways. And then you can see there how that little airbag here, I'm not sure if you can see my cursor, but how that little airbag, inflates. Can you guys see my little lightsaber here? My little red dot. Can you not see? Can anyone see this?
Yeah.
Can anyone see me drawing on the
Yes, we
screen?
can see it. We
Yeah,
can see it.
Okay.
I cannot, but I'll imagine.
Okay. Well, I'm looking at the arm on the right-hand side where you can see stethoscope. And if you go up, you can see two little oval shapes.
Okay, see.
Now, that's the bag inside the cuff.
Oh, I
Now,
see. Okay.
that inflates, therefore applying pressure. Does that make sense? So now you're applying pressure. You see how the artery gets compressed. Whereas if you look at the artery in the image on the left, you can see how it's nice and open. So it's compressing it, and then you're slowly letting blood through there to see the pressure at which it flows. Does that make sense? So it's almost like we like beavers, and we've created a dam, and we're going to slowly let the water through to see how fast the water is flowing. Does that make sense? Your screen is still on heart rate. We are on blood pressure. Is everyone else's screen?
No, mine is fine.
And I'm on blood pressure. Celia? Are you still on heart rate?
Yeah, still on heart rate.
You maybe. Is there any way you can refresh? Is that a thing?
Let me try.
All right. Now, blood pressure. If there is a discrepancy between readings, press sync to the live. Okay, thanks, Miller. I don't know how to do that, but when she gets back, if she does need that assistance. She's back.
Mm.
Better?
I'll check now. A moment. Yes, thank you.
Okay. Now, if there's a discrepancy between readings taken on different arms, it could indicate the existence of a circulatory problem. As the pressure is released, the so-called Korotkov sounds can be heard in distinct phases. The first sound signifies the beginning of the first phase and represents the systolic blood pressure reading. As the mercury continues to fall, the sound will change in quality to a louder, sharp tapping. This represents the second and third phases, which are of no particular significance when the measuring resting blood pressure. The fourth and fifth phases, which involve the disappearance of sound, usually coincide. Diastolic blood pressure is read when the sound disappears. However, during exercise, the fourth phase may be a muffling of sound representing the diastolic blood pressure. The fifth phase, the muffled sound, sometimes disappears shortly thereafter, but it must last until the pressure is completely released. So this is what we're looking for. Silence. Remember, now this is when you're listening, okay? It's going to be silence because you've, and then you're going to hear doof doof, and you're going to hear doof 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 doof, and then silence. Make sense? That is pretty much what you're going to see. Now, on here, on the sphygmo manometer, that needle you're going to see going between. Billy, are you on the same page as me? You can see the blood pressure page. Okay. So you can see it's going to start probably somewhere there, and then it's going to slowly make its way around. Cool. All right, posture. Standing posture, right? When assessing standing posture, a plumb line is used as a reference standard against which deviations can be measured. Guys, this plumb line can be anything. It can be a pole, it can be a line on the wall, it can be a door frame, as long as it is pretty much as close to 100% straight as possible, right? It can be a pipe, right? But make sure it is straight. Could you imagine if you use a skew line and now you're telling this person that they are monumentally screwed, and meanwhile you've used a skew line? It's like a builder using a skew ruler or an inadequate level. And then he's going to be telling you that, listen, I've built your house to perfection. And you're going to be walking in there as if you've had too many to drink, right? It's not going to be so lacquer, right? Now, the points of reference, right? The feet are used as a standard fixed point when measuring standing posture. With the plumb line, the point of reference must be at the base of the feet. When the posture is viewed from the side, the lateral view, the fixed reference point is slightly in front of the outer malleus. In posterior view, the point is midway between the heels. A posture analysis is performed by an anterior, posterior, and both lateral right and left views. Some changes can be observed only from a particular view. For example, the clavicles can only be observed from the anterior view, whereas other changes can be confirmed by analyzing two views, such as if the ACEs are leveled, the PSIS will likely be level 2. If they are not, one can check the ACEs again to confirm the observation. Now, what do I mean by this? There's our plumb line, nice and green through the middle. See how it's going straight through a lot of these points, right? And we all see this image of Casper, the friendly ghost here.
Mm-hmm.
We all see that. Cool. Now, when you see this is of course from the side, but of course you can imagine from the front, you want it going down the middle, from the back, down the middle, right? You want to see where the inadequacies are. Now, remember, there's a natural curvature of the spine, right? So if there is a curvature of the spine, no, they do not have scoliosis, no, they do not have kyphosis, and no, they do not have lordosis. But you are able to see if maybe they do. If they have the shoulders completely rounded like this, you know, they probably have kyphosis, right? So what do we need to do? We need to stretch out the chest muscles because they probably are too tight over a long period of time. Stretch them out and strengthen the back muscles to pull the shoulder girdle back a bit, right? Does that make sense? Okay, so you can really start to see from like this angle how we can improve their chest exercises, but equally how we can maybe improve their back exercises as well. Shoulder joints, we can see what is their shoulder mobility like. Is it nicely neutral? Is it too far back? Is it rounded and forward? Sense of gravity. You can see their hips, you know, how they sit with their hips. You can also then gauge, you know, you can also see how tight their quads are, how tight their groin is, looking at the hips, knees, excuse me, and then the ankle joint, right? So then you can have a gauge. Now you can imagine this from the front, etc., etc., etc. Now, posture, pre-test instructions, right? The following instructions should be provided to the client. Wear tight clothing. If it is female, preferably shorts and a strappy top. For male, shorts without a shirt is ideal. Again, remember what we discussed before, right? Remove shoes and socks and stand comfortably with arms next to the slides. No, we are not selling feet pics, people, right? Let's just get that out. Cool. Do not tell the client what you're looking for initially, as they will try to correct their posture. Of course. Ideally, one can take a photograph with the client's consent of all 4 views, which can be referred to in the future to determine improvements. Please note that it says with the client's consent. We are not there just taking photos willy-nilly of people. Please ask first. If they say no, it is important to explain to the client the benefits of posture analysis and what one has observed at the end of the posture analysis, as it can be quite uncomfortable for the client if they understand what one is doing and why they do it. It brings some relief, right? Posture, performing a posture analysis. Now we're just going to go through this, right? It's quite in depth, but if you're looking from the front, are the earlobes level? Why do we need to know if are the earlobes level? Maybe you potentially have your neck like this. Are they necessarily level? No. Right? Could have a tight upper trapezius or sternocleidomastoid and or scalene muscle, which will need to be stretched. Are the shoulders level? Remember the handbag scenario? If not, the higher shoulder could have a tight upper trapezius and or levitated scapulae. However, it is normal for the dominant side shoulder to be a little bit lower due to the ligaments and capsule being slightly more lax. Are the iliac crest level? If not, it could be a possible length of discrepancy, or it could be due to a shortened quadratus lumborum on the side of the iliac crest is higher, or it could have been due to a large fall which resulted in an upslip in the pelvis, or it could also be as a result of scoliosis, right? You guys know what the iliac crests are, right?
No.
So you're looking at the top of the hips.
Okay.
Okay. You're looking, see where the hip joint is there, right? Just imagine there. You know, like you can almost feel them on your side. Like if you touch your waist, you can almost feel your hips, right? Is the spine straight? By palpitating along the spine from the top to the bottom, one can determine whether there is a scoliolytic curve or not. Are the scapulae flat against the thoracic wall? If not, it could be pseudo-winging. Inferior angle is elevated of the scapulae, which is due to weak lower trapezius and tight pec minor. Or it could be true winging in the sense that there's the medial border of the scapulae is elevated, which is due to overactive rhomboids and weak serratus anterior. Are the greater truncatus level? If not, it could be due to a leg length discrepancy. Excuse me. Is the ear and eye on the same level? If not, it could be due to slight elevation of the chin. Okay. Then we look at, does the spine have the normal S curve? Is the thoracic region perhaps too flat, or the thoracic region is too rounded? For example, kyphosis, as we mentioned before. Or is the cervical region's curve more pronounced, such as a forward head? Does the plumb line run through the middle of the shoulder? You know, this is looking from the side or the lateral view. If not, the shoulder should be anterior translated due to tight pectoralis and weak upper back muscles, predisposing an athlete to shoulder impingement. What does the lumbar curve look like? Is the lumbar curve neutral, right? Or is it more pronounced? It's a case of lordosis and an anterior pelvic tilt, right? Does the plumb line run through the greater truncata and knee? If the plumb line is in front of the knee, it could be due to hyperextension, which is normal in women, and particularly dancers and gymnasts. If it is behind the knee could be permanently flexed. Does the plumb line run just slightly anterior to the lateral malleolus? Is the lower leg perpendicular to the ankle? If the angle is greater than 90 degrees, it can be due to the hyperextension of the knee. If the angle is smaller than 90 degrees, it could be due to knee flexion. Now, very in depth, but you get the point in the sense how many different things we can get from measuring, right? From assessing posture, right? Remember, it is not always going to be an exact science. You're not going to get everything right. But now you have 12 things there. Now, if you measure the blood pressure and all of that, and you do the heart rate, and now you move on to posture, we still have all the other assessments that we're going to go through. You still have body composition assessments. You still have strength assessments, speed assessments, whatever the case may be, whatever dictates for your clients. So with posture, you're going to be able to set, okay, turn, okay, turn, okay, turn, okay, done. Right? No more than probably 30 seconds on each one. Because if you stand there with a checklist and you're going, is this equal? Now you're getting out the tape measure. This is where photos sometimes are beneficial because you can take those photos and go through them at a later point and you can see the imbalances without taking too much time. But in the moment, you just want to put yourself in the ball zone, like in the game. You want to get yourself there, and just be able to see if there's any glaringly off-put posture that is there. Like mainly the shoulders, anything that is directly visible that you can see. Okay, cool. Like you can see sometimes people have tight calves, so you'll see that they can't put their feet flat properly. Right? You can look at that. You can look at, like I said, the shoulders against the wall. What's their shoulder mobility like? So you can see a lot of all of this. Does that make sense to everyone? Cool. Now, body composition. Now, guys, what I want you guys to think of when we do this, right? When you look at this body composition thing, sometimes this can be a hard pill to swallow for some people because they don't really want to know because ignorance is bliss, right? In the sense that, majority of people who are overweight don't need someone else to validate that they are overweight. They can clearly see that they're overweight. Hence why they're asking for help for you to help them lose weight, right? And I mean, people aren't blind. Like people wake up, you look in the mirror, you brush your teeth, you do whatever you need to do. I mean, like you can clearly see where you are physically. Now, I'm not going into the realms of body dysmorphia and all of that, where someone's clearly in good condition, but they think they're not, or whatever the case may be. But especially this, when you're working with general population clients and they've come to you, please be mindful. Right? Like when we do some of these assessments like waist to hip, waist circumference, all of that, girth measurement, skin fold, when you're using tools, if, for example, you look at a tape measure and you know that the tape measure isn't big enough, or it may not be big enough, hypothetically speaking, don't do the test. Can you imagine what a tool that person must feel like? They've come to you, they're putting themselves out of their comfort zone, they're really trying, and then the tape measure doesn't go all the way around. I mean, like that's not necessarily like, and it's going to feel awkward for you as well. It's not just about them in that sense, but imagine how awkward you're going to feel. Like, yes, you mean well, but could you imagine how awkward you're going to feel if you try and wrap a tape measure around someone and it doesn't fit? Or the same if someone's incredibly underweight and you use the biggest tape measure you have, and that thing's like wrapping your father's belt around yourself when you're a toddler. Right? It's just, let's just be present in the moment. Let's just look at that. And like I said, you can see here, BMI, waist to hip, waist circumference, girth, skin fold, bioelectrical impedance. 1, 2, 3, 4, 5, 6. Now you've already done posture. Now you've already done, heart rates and all of that. Let's say you give yourself 45 minutes to an hour How many of these are you really going to be able to do? That's why I said, while you're going through this, see what things you gravitate towards, what things you understand, because there's no way you're doing all of these in one sitting. No way. And you'll see there's even more as we go on. For example, you know, even if we go on, we're like, look here, when we do testing, look at that. There's fitness, endurance, strength, power, speed, flexibility, agility. 1, 2, 3, 4, 5, 6, 7. 7, right? And that's just fitness and agility. Plus 6 here. I mean, that's 13 assessments. That's if you do one of each. Does that make sense? Do you see what I mean by, like when I said earlier, you've got to be able to see what is going to work best for you, what brings the most value to you, what do you think will bring the most value to your clients, what do you think you are able to quantify effectively enough to develop a program adequate and substantial enough for your clientele. Would it be great to do all of them? Yes, probably. But also, more assessments doesn't mean better programming. Always. You know, there is also a happy medium. Sometimes you're just doing more for the sake of doing more. There's no actual direct benefit for your client. Also take note of that. Cool. But also in this time, when you're doing this is when you can really show your client your assessment to detail, or attention to detail, sorry. And where you can really show them that, like, hey, you know, I'm in business here. Like, I want the best for you. Okay. Body composition, BMI. No, ladies and gentlemen, it is not up to date. No, it is not 100% accurate. Yes, it is still valuable. Sorry, we have a question here from one of your colleagues. What's your go-to amount of those testing options, or ones that you would consider important? That is completely up to you, Mello. It is completely up to you. However you choose to. But we'll get to that at the end when we can have a little bit more of a discussion. BMI, yes, it is what it is. Body mass index, also called the Quetelet index, or the Quetelet, or however you want to pronounce it, index, is used to assess weight relative to height and is a measure of leanness. It is also calculated by dividing body weight in kilograms by height in meters squared. Please, guys, the height is squared, not kilograms over height squared. Okay. So the actual bottom number is squared, not the whole fraction. Okay. One of the major problems with height or weight tables and the BMI is that both methodologies do not take into consideration whether the person is heavily muscled or overfat, right? However, if you had to do this on me, right, I weigh approximately 88, 89 kilos, and I'm 168 centimeters tall. Yes, I am short, sadly. Right? I wouldn't say I'm short, but I'm shorter than most males. If you had to put me here, I would be obese. I can guarantee you I am not obese. Right? The point being, is it useful? Depends on what you're using it for. Right? If we have a client who wants to lose weight, and Precious, I'll answer your question now. If we have a client that wants to lose weight, right? And let's say the scale is becoming consistent. So they've gone, let's say, 70 kilos, 68 kilos, 66 kilos, 64, 62, 62, 62, 61, 61, and it's flattening out at 61. They're going to be like, oh, I'm not progressing because the scale's not going down. Or maybe you're building muscle. But if we want to use something that is slightly more quantifiable, we can then use the BMI, because by default, if you are losing weight, your number should be dropping. Does that make sense? So maybe you started at 32, but by losing weight, you'll be somewhere by 25 or 24. So by default, by losing weight, that number should go down. So you don't necessarily have to use it to categorize someone, but you can definitely use it as a form of, as a quantifiable measure to gauge whether your programming is working for your client, and vice versa. If someone wants to put on weight, if their BMI is not increasing, well, sucks to be you, but they probably are not putting on weight. Does that make sense to everyone? And it does not necessarily mean that it is 110% accurate, because it's not. Okay. Precious, you had a question.
Cameron, I think you just answered my question, because I just wanted to find out. So then when do we use the BMI, the body mass composition? When do we use it? If it's always, if it's always like, no, then it's not accurate. No, then it's because of
look, guys, like you'll see with a lot of this stuff, not everything you have to do here is compulsory. And you'll see when we get to the end, when you look at all the tests, you're going to be like, holy smokes. Not everything is as important. Like, you could get someone who's in absolute mint condition who wants you to take them to the next level. You may not necessarily, BMI may not necessarily be something that you're paying attention to, but it is something that if you have their weight and you have their height, you can calculate at home. You know what I mean? Like, it's something that you can very easily calculate when you're doing a check-in, right? It's something they can easily calculate when they doing their weigh-ins or whatever the case may be. And all depends on the value you place in it as a trainer or as a coach. If you see no value in it, don't do it. If you see value in using it, use it. There's no hard or fast rule that dictates that you should or shouldn't do something. Yes, Robert.
So with it comes to body composition and the measurements of these stuff, when you go to someone like a dietitian, for example, and they, instead of doing the measurements themselves, they use one of those scales with you, hold with your hands out in front of you, and
yes,
it's
the
supposed
in-body
to,
scales.
so that measures everything. How accurate are those things also when it comes to the measurements?
Personally, I have used them before. So I've done corporate medicine and stuff, and we used to do all of this with companies and what have you. The reality is the same thing, and I know this isn't probably the answer that you want, but it's the answer that I'm going to give. Depends what value you want to take out of it. Are they 110% accurate? No. How is something that you stand on and you hold the side going to be 100% accurate? The only thing that is accurate enough to give you a distribution of body mass is probably going to be a DEXA scan, which is going to be an awfully expensive test to do, right? Now, what they're doing is they ruling out reasonable doubt. So what they're trying to do is put you in the ballpark of roughly where you are and where they want to get you, right? And that's also when it comes to value. Like, if you are hell-bent on BMI and you can rationalize and explain the value behind it to your client, then your client will probably become the biggest fan of BMI, and you may become the biggest fan of BMI. But if you scrutinize BMI, if you scrutinize it enough and you look for enough flaws in it, well, then you're probably going to find flaws, right? So it all depends on what are they using it for, what are they trying to get out of it, and how do they utilize its information that it yields. It really depends on from one individual to the next. Does that make sense?
Yeah.
Okay. Body composition, waist to hip ratio, really easy. Waist to hip ratio is used to identify individuals at risk for disease. These anthropometric methods are relatively inexpensive and simple. Waist to hip ratio is the circumference of the waist divided by the circumference of the hips. There's a difference between waist and hips. This is a simple method of determining body fat pattern. Waist measures at the narrowest part of the trunk above the umbilicus and below the xiphoid process, and the hip is measured at the maximal circumference of the hips or the buttocks region, right? I'm pretty sure it's self-explanatory. Waist, you can imagine your waist, right? By your belly button, and then your hips by your hips. Shocker. The hips are measured by the hips. Who would have thought? Right? Now, you then take that, you have a ratio to it, and then, of course, I put you in a relatively normal risk, high risk, etc. Right? Again, like the BMI, use it, don't use it, see where you find value in. It could be something that you could use to show, hey, maybe you do it initially and you just keep it in the back there, and then in a month or 2 or 3 months, however long you've been working with them, or 8 or 12 weeks, then you can be like, hey, look, your waist hip ratio has gone from this to this. Probably not going to see the most benefits in it doing it every single week, but probably over a longer period of time, it is something that you can use just to show your clients, hey, I know you think that you're not progressing, but look where you started and look where you are now. Okay. Waist circumferences, given that the risk of problems mentioned above are associated with abdominal obesity, the following waist circumferences would be classified as high risk. So 102 centimeters for men, 88 centimeters for women. This is founded from Powers and Howley in 2009. It is important to remember that during weight reduction programs, the size of the fat cell may decrease, but the number does not. Right? We know that, right? You cannot remove them, right? Once you've developed that, you can get lean, yes, but you're not necessarily reducing the number of fat cells. You're just removing the fat from the cell. Does that make sense to everyone? The structure is still there, which is why for some people who maybe were heavier and then they lost a lot of weight, sometimes it's easier to put on that weight again in terms of from a visual look, because those cells are still there and you can fill them relatively quickly if you wanted to. Okay. Yes.
So if you lose weight, the fat cells just shrinks against your, let's say, your tummy or whatever. You don't see it
Correct.
necessarily.
Correct.
That's cool.
Which is also why, if you look at people who have taken the time to build muscle, they'll often be able to get leaner a lot quicker. And everyone's like, oh, you're taking gear or whatever the case may be. Well, when you've taken time to build that muscle, that muscle's there, right? And it takes a lot of effort to get rid of muscle, right? Which is why when you look at bodybuilders and their health markers, a lot of their health markers are not because of poor life choices. A lot of their health markers are because they have so much muscle. And a lot of the time, the only way for them to get healthier is to lose a lot of that muscle. Right? So even if you look at like the fat cells or someone who's maybe been overweight before, when they lose the weight, they're just removing the volume from that fat cell. Right? Now, if you show your body, right, I don't want you storing all this food anymore, I want to utilize it as energy, there's various different processes that can limit that fat cell from being filled again. But in reality, it's probably still there. That's also why people go for liposuction and stuff like that, right? Because it's an easy way out, so to speak. But from a longevity point of view, from an overall net health point of view, I don't know if it is the healthiest thing or not, but there are definitely two sides to it. Yeah. Cool. Girth measurements. Anatomical landmarks for girth measurements are as follows. So if you look at the chest, you have the abdomen, you have the waist, the upper arm, the forearm, the hips, the thigh, and the calf. Now, girth measurements, you're going to use the tape measure. You're going to see how wide they are, right? Now, again, an element of being polite and discreet should be adhered to during this. If someone feels slightly uncomfortable, if they feel like it is a little bit more invasive, don't do it. It's really as simple as that. Or sometimes maybe you want to give them the tape measure and you just stand there and you say, no, please measure a little bit closer. Can do that. Probably not the best way to do it, but if you are hell bent on getting girth measurements, then cool. If not, you can see there's many other exercises that you can do there. But I'm pretty sure girth measurements are self-explanatory. Anyone have any problems with that? Cool. Body composition. So we have skin fold measurements. You guys know the skin fold gun. You pull the skin and you get a measurement of, the skin fold or whatever the case may be. Skin fold measurements. You have the abdomen, you have the thigh, you have the triceps, right? You can also go further on. You have the suprailium, right? You have the subscap, you have the medial calf, you have the mid-axilla, and you have the chest. Now, when you look at this, you can just type onto like Google that I'm doing these measurements. So you can just type skin fold measurements for argument's sake, and it will bring out a calculator for you. And then that calculator is based on 4, 6, or 8 measurements, and it will tell you what those measurements are. It all depends on which one you're going to do. You're going to do 4, 6, or 8. It probably is more, like 12, but realistically, it's going to be tough. Now, the same thing with the tape measure. With the skin fold measurement, you are going to pull open your gun, so to speak. So it's going to open this, right? You're going to pull the lever and it's going to open. Now, if you can clearly see that you're holding the piece of weight, and this, again, can be invasive for some people, but if they're comfortable with you pulling their skin a bit, and you do that, and you know that the gun is not going to be big enough, just don't do it. Okay? For reasons that we've previously discussed as well. So, is a great way to get as close to what body fat percentage that they're probably looking at. But it can also be skewed. I mean, like, some people can't help it, but maybe they store weight in their stomach area. Some people may store weight in their arms. So while there may be an element of lean, the fat that they do have on their body may just be kept in other parts of their body that they have no control over keeping there. So also, take that all with a pinch of salt, and then it will spit out to you a rough estimation of what their overall fat content is. Everyone in agreement? Anyone have questions? We sure? I'm getting a lot of luck. Are we all bobbleheads now? Have you guys watched Night at the Museum 3-2? When they go to the Smithsonian, you have all the Einsteins. And it's, Okay, guys, we're going to take a quick 5-minute break. Okay, go stretch, go to the bathroom, do what you need to do. Go get your Starbucks, go get your Seattle, go get your Vita, go get your Woolies, go get your matcha chacha or whatever, lattes, whatever, right? Go do what you need to do. Grab a glass of water. Let's come back. We have roughly 10 slides to go. Then we can have a nice conversation about how we plan all of this. But quickly take a 5-minute break. Do what you need to do, 10 minutes, whatever. When everyone's back, I'll ask everyone to put a thumbs up, and then we can crack on. Cool beans. Okay.
Thank you.
See you guys now.
It's good for at least a 10-point bump.
Right now, you're down by 20. Where do you find the other 10?
John, the Court County Commission and the small businesses, go to the pancake breakfast, the ballparks, the Rotary, the current is. Every election pretty much works the same down here.
And the research
Yeah, I'll run a quick study.
still might not be enough.
You knew my father. I have the same attitude about losing the here.
Your father.
All right, can everyone hear me? Am I audible?
Hello. Yep.
Okay. Sorry, I apologize for the delay there. Yeah, just had minor delays, but alas, did everyone go and get what they needed to get? Coffee, tea, a sense of humor? I don't know. No, I'm just teasing. I'm just teasing you guys. All right, guys, let's crack on. I'm not sure where everyone is, but where I am, it is cooking. It is hot. So, yeah, let's not make this longer than it needs to be. Let's enjoy it. Let's get it going. And I have no doubt that we'll be done in no time at all. Now we're going to start going into the testing. So we're done in our little room, personal trainer lounge, whatever the case may be. We've done our assessments. And now what do we want to do? We now want to test where they are at physically. Right, so we have fitness testing, endurance, strength, power, speed, flexibility, agility, you name it, we got it. Right, now you can possibly do one of each. You can do out of the 7, you can do 3 out of the 7. No one's saying you have to do 4 or 5 or 6 or all 7, right? But there's probably 1 or 2 here that you probably do want to do, because if you're going to program, you can't just program on health. You need to also know what is their current physical capability to be able to create something that is sustainable for them to be able to administer or adhere to. Are we in agreement? Cool. So here we have fitness testing. So we have the 2.4 kilometer run test, the 9 or 12 minute run test, and then we have the treadmill tests, which include the Bruce treadmill protocol, the multi-stage maximal treadmill protocol, and the single-stage submaximal treadmill walking test. Now, where are most of you guys going to be working with clients? Online or in the gym, correct? Or in a high performance center or a health center or whatever the case may be. Is the 2.4 kilometer run test going to be the most efficient? Maybe, maybe not. Are they able to run, right? Treadmill tests are also very good, but they aren't always the most pliable, right? Because it depends. Is the treadmill able to do what you need it to do? Are you able to measure what you're able to measure, right? But probably the easiest one is probably going to be the one of the first two, the 9 or 12 minute run test or the 2.4 kilometer run test. If you're going to do the other ones, they can be very good, but you need to know how to do them, okay? Because it's going to take time to set up, etc., etc., etc. And if you aren't efficient in that same breath, it's just going to take more time, right? It's easier to get someone to run for 2.4 kilometers or run for 9 or 12 minutes. But if you can see that someone is not necessarily the fittest person, are you going to make them run for 12 minutes? Probably not, right? So they are difficult from a fitness test, but, you know, please make sure that you warm people up properly and effectively before, you know, before putting them through that. Is that fair to say? Cool. Any questions on fitness? Okay. Endurance. You can do, for example, the 2-minute sit-up test. You can do a partial curl-up test. You can do the 1-minute push-up test, or you can do the YMCA bench press test. Does anyone know what the YMCA bench press test is?
Nope.
Have you guys never watched Shrek?
Oh, damn.
YMCA. Dun, dun, dun.
Yes.
No, that's not that. So what it is you go into Google on your phone or on YouTube or whatnot, and you Google YMCA bench press test, and there's a sound. So what this wants to analyze is, let's say you set a weight, right? There'll be a specific category there that you're looking at of your 1 rep max, for argument's sake, right? So let's say it's 1 plate each side, so 60 kilograms in total. Now you're doing a bench press test, right? And what you're doing is you're bench pressing, but what happens is that it goes doot, 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 doot. So you have to keep up with the tempo that test is giving you.
It's like a bleep test or something.
Yes, but for the
Yeah.
bench press. So you have to keep up with the tempo that they have. Okay. So when we look at that, you can look at that. If you think of the 1-minute push-up test, self-explanatory. If you think of the partial curl-up test or the 2-minute sit-up test, so there you can do a 2-minute sit-up test and you can do a 1-minute push-up test. But you have to make sure that someone knows how to execute that properly. So how many people know or are strong enough to do a push-up? You look at that, right? And can you set up for them? So granted, while the push-up may be the best one in terms of time and etc., if you're spending half the time to first show your clients how to do a push-up, can you do a push-up? You know, you also got to mitigate risk in terms of injury risk, right? So you also need to look at that. Is that fair enough to say? Right? Any questions on the endurance side or what you're looking at? Anyone? Going. Sold. Right. Now strength. When we're looking at strength, muscular strength and muscular endurance and strength tests are also important, as one can confirm observations made in the posture analysis. If a muscle is overactive, is that muscle tight and strong, or is it tight and weak? For example, one may observe an individual with forwardly translated shoulders. However, performing a 2-minute push-up test, one may realize that the muscular endurance of the pectoralis is in fact weak despite their hyperactivity. Performing muscular endurance tests with a posture analysis provides the exercise specialist or yourself with further pieces to the puzzle in order to design a more individualized or rehabilitation program. Examples of these tests include a partial curl-up test, a push-up test, a YMCA bench press test, and a 1-rep max bench press or back squat. Please, can you guys comment on the last one? What are your thoughts on a 1-rep max bench press or back squat?
It's very risky.
I agree. But where's that risk to reward benefit?
I don't know.
Do you know what I mean? Like, if you have someone who's been in the gym before, they know what they're doing, they know their way around, they have a general idea of what they're doing, what exercises they're doing, what a dumbbell is, they've have an element of experience, then probably like go ham and cheese, like go, do the 1-rep max bench press or back squat if you feel comfortable that they know what they're doing. The problem that you're going to have is if you have a complete novice and you want to do this test, the bench press and the back squat are two of the most technically difficult exercises to do. How you set up for it, how you execute it. It takes time to set up effectively. Would you agree?
Definitely.
It's not
Agree.
always like if you think of someone who's never had weights on their back before, now you want them to do a 1-rep max back squat, and they crumble underneath the bar. Like, you don't necessarily want to injure your client before you start working with them. But it can be a very good indicator of baseline strength. But that's where you have to look at your clients, like, of these tests. That's why I said at the beginning, you have to look what caters more towards you, what's going to cater more towards your client. Because for some people, yes, the 1-rep max bench press and back squat will probably be the most ideal form of strength-based testing. But sometimes it is what is necessary, but sometimes it's also not what is necessary. So you need to be able to work between that. You need to be able to look at that and think to yourself, right, hey, maybe a more of a YMCA bench press test, or maybe a partial curl up or a push up test is probably going to be more optimal for you and what results you're trying to get right out of your client. Everyone good with strength? Okay, now power. Anyone a fan of Jeremy Clarkson here? Top Gear. And he was like, more power. When he wants more speed. Yeah. Okay. Sorry, guys. I'm weird like that. Maybe I'm autistic. Maybe I'm not. I don't know. Cool beans. Let's crack on. Right. Power. So you have the standing long jump test, right? Lower body power can be assessed by a long-standing jump test. The client should line up behind the starting line that is attached to a 3-meter long measuring tape that is stretched out in front of the client. The client is asked to jump as far as they can. A counter movement is allowed. The client should land on both feet. The measurement is taken at the back of the foot that is closest to the starting line. The best of 3 trials is recorded to the nearest 1 centimeter. Again, if you are looking at your client and they've never played hopscotch before, or they don't really understand, or maybe in a gym, like, where are you going to do this in a gym? Maybe there's a studio that you can work in. Maybe there's a place where you can jump or you can do something like that. But if you're doing it at 5 p.m. when the gym is more packed than a border crossing, crisis, like, what are you going to do? Now you need what? 3-meter long measuring tape. You need to set this up. You need your client to be able to warm up effectively, be able to do this. Like, we need to also be practical in what test we're going to choose for the situation. And that's why you need to look at what are you most comfortable with and what is going to be the most easiest, because maybe you've planned, right, we're going to be doing this standing long jump test, and you get there and all of a sudden, it's peak hour at the gym and you don't have the space or the facilities to do it at that moment. Can you adjust? How important is that test? How important is it not that test? And we need to be able to work through this, because at the end of the day, your client's taking time out of the day for you to test them, and you need to be able to administer that. Fair enough. So when we look at this, it's not always about, cool, what is the easiest one to do, but it's also like we need to think of situation, right? Now, when we look at this and we're going to do the jump test, right? As great as it can be, just we need to be mindful of what people are able to do. We don't want anyone to get injured. We don't want to put ourselves in that predicament. So please, like with all of these testing things, you just need to have an element of discretion, just an element of just like, I'm not saying now you be Rambo and you do every single test, but also I'm not saying now that you be Mother Teresa and all you are concerned about is peace. So you're just not going to do any of them, right? There's a fine middle point where we can meet and we can, you know, come together and generate a testing protocol that is suitable for your client. Fair enough. Another power exercise is a vertical jump test. Now, this is probably more applicable, right? Because you're just jumping, right? But not every place has these facilities. If you short round like myself, right? And you try and do these tests and I'm trying to measure, I'm going to go and need to get a ladder, right? Now, if you do this, the lower body power can also be assessed using the vertical jump test. This test assesses the musculature that propels the body up vertically. When selecting lower body power test, that the movement that is closest to that of the sport that the client does should be the determining factor in the test selection, right? The client needs to dip the dominant hand in chalk and position. So just one moment. The client needs to dip the dominant hand in chalk and position body next to the wall, with the dominant hand reaching up against the wall. Mark the highest point that the hand can reach, and then once again dip the hand in chalk. The client then performs a maximal jump and makes a second mark against the wall at the highest point. The jump reaching up with the dominant hand, the distance between the two marks is measured, and the best of 3 trials will be recorded. What this means is it's not from the ground and then where you slap, right? It's the distance between, if you stand and you raise your hand at the top, you're going to measure there at the top of your hand, and then the distance that you travel from jumping up and touching. So you measure the distance between the 2 finger points, right? Which is why when you go into most high performance gyms or that, they'll have those plastic slats that you slap when you jump, right? It's like little arms hanging on a pole, right? And you almost jump and you hit, right? And what you do is you set the bottom one, so you mark it there, and then that's where you set the bottom one. And then that may be at, I don't know, a certain mark, let's say 15. And then you jump, and then let's say you hit number 22. Therefore, you've moved 7 centimeters. Does that make sense? So your vertical jump test is 7 centimeters. Not 22 centimeters, 7. Make sense? So you do it 3 times, and then the best of the 3 times. Cool. Everyone in various agreements, or do you guys think that I'm just mad? Are we all cool beans? Cool beans. More power, we can also do the 1 rep max power clean test. So we can instruct the athlete in proper technique for the power clean. Warm-up sets are performed and load increments are selected as for the 1 rep max bench press test. Again, guys, how many of you guys know how to do a power clean? Okay, we have 1. Anyone else here know how to do a power clean? Is it because you do CrossFit? Do you do CrossFit?
I think I do. I don't follow a strict exercise program, but sometimes I do love snatches and cleans.
Okay. Precious, you raised your hand.
I also know how to do a power clean.
Do you?
And
Okay.
this is not from CrossFit or anything like that. Just from the gym and having the interest to like CrossFit exercises. Yeah.
Okay. Power cleans are very, very good. The unfortunate thing though is that I don't necessarily think every single gym is set up for people to be able to do power cleans and exercises like that, unfortunately. But if you do have the space and you're able to do it, then I do think it's a very good exercise. However, if you know how to do it, if your client has never done it before, why on God's green earth are you going to make them do a 1 rep max test on a power clean on an exercise that they have no idea on how to do? It's one thing watching people do it. It's another thing knowing how to do it themselves, especially a 1 rep max one. So I would, if in time, because you're not just going to do this test the first time you meet your clients and then never again. You may do them every once a month, twice a month, maybe once every 3 months. You know what I mean? You may do them semi-annually, twice a year, but you will do them more than once. So maybe as your client gains more experience, then maybe you'll do them at a later point. You never know. Cool. Now, for all the Top Gun fans in the house, if you guys have watched the first movie when Maverick and Maverick goes, I've got the need for speed, right? So now we're going to go on to speed test, right? Or if you're a fan of cars and Lightning McQueen is like, I am speed, right? Okay. Now, sprintability is an important factor in most sports. Shocker. Who knew that you had to be able to run fast in sport? In team sports, athletes generally have short intermittent bursts, about 20 meters in distance, with active recovery between each explosive burst, right? Due to the short distance, the anaerobic energy systems and fast twitch muscle fibers are predominantly used in this type of activity. Speed can be assessed by using the 37-meter or 40-yard sprint test. The test involves running a single maximum sprint of 40 yards with the time recorded. After a thorough warm-up, the client is given at least 2 trial runs at sub-maximal speed. The client is allowed to rest in either a 3 or 4 point stance. In a 3 or 4 point start. The athlete is started with an auditory signal, a voice or whistle. The client is then given 2 trials. The time should be recorded to the nearest 0.1 second, and the average of the 2 times is recorded. Only issue with this is that if you're going to try and do it in a gym, where you're going to find 37 meters that no one's going to use. I know Virgin has started introducing, those 10 or 20 meter bits of fake grass, artificial turf, where you can maybe have a sled push or something like that. But here we need 37 meters, right? And how are you going to make sure that's accurate? Probably the best place to do this is on a field or at a track. I'm not sure if any of you guys live in Joburg, but if you guys are in Johannesburg, I know that Planet Fitness at the Buzz or there by Fourways, they have a track around upstairs, like where people can walk or jog or whatever. But that probably has 37 meters worth where in a straight line where someone can run. What you could do is if you're on some of those sprinting treadmills, you probably could set the distance to 0, but I would just be worried if someone's never sprinted on them before, trying and getting them go full tilt. You don't want them to fall and slip on that. It's just, I think even for the normal individual, it is quite a strange feeling having that thing move underneath your feet. So it is something that possibly could be used. But again, this isn't the only test, but from a speed point of view, it's probably the easiest to do. Right, so that 37-meter sprint test. Flexibility. Now, a thorough assessment of flexibility can aid in injury prevention. Flexibility tests are covered in previous chapters, of course. A flexibility test can often confirm observations made in the posture analysis. For example, one may have observed a severe anterior pelvic tilt and lumbar lordosis. This client will probably also have a bad skin retraction score. Therefore, with an improvement in the skin retraction score test, and with the teaching the client to find pelvic neutral, one could see improvements in the standing posture after exercise intervention. The importance of these tests should not be underestimated. Here we have a goniometer test, a skin diffraction test, and a sit and reach test. Does anyone know what a goniometer is? Anyone without using ChatGPT or Google?
It measures something.
Well, I mean, heck, we are doing assessment tests, so I hope we're measuring something. So, yes. What do we think it's measuring? If we think about flexibility, what do we imagine it will be measuring?
Your range of motion.
Okay, range of motion, but what are we measuring with range of motion? How do you know that range of motion is improving or digressing?
Like for instance, if you're gonna do a sit and reach test,
okay,
and how far the person hands reaches on the thing, on that ruler thing that we use. So maybe if you do it, I don't know.
Yeah. But here I was more referring to the goniometer test. You are completely correct with regards to sit and reach. There we are measuring flexibility and range of motion. But when we look at the goniometer, what is that specifically measuring?
Oh, okay.
Sorry. You go first.
No, Inga, it's fine. You can go.
I think maybe is it not when you bend your knees in a squat position and then when your heels start to lift up from the ground or something?
No.
Okay.
A goniometer, as you may have seen some physios use this, a goniometer is effectively a human protractor. So you're measuring degrees of flexibility.
Okay.
So you remember when you did maths, you had your protractor and it has 180 degrees and you go, but it's like a human one. It's a big one and you can move it, right? So you use this. So for example, if you're looking at hyperextension of the back, how far can you move your back? You'll put it in line with your pelvis and then you'll see, right? So there we have, 60 degrees, right? Or whatever it may be. If you look at your knee, if you want people, maybe they're recovering from an injury, they sit on the side of a physio bed and they'll let their leg hang. You'll be able to see what degree does their knee, can their knee go to 90 degrees? Can it go past 90 degrees? So you will be able to see flexibility from a degree point of view.
Okay.
The sit and reach is probably going to be one of the easiest ones for you guys to do. You set it up, some gyms even have that little box that people sit on that you can, but you need a tape measure and a little bit of a ruler or a starting point. And you're just going to be you're going to have them sit and put their arms out and, in front of them. And that's going to be the starting point. And then you're going to see how far they can lean and reach, right? They're used to checking the flexibility of their back and their hamstrings or their posterior chain, so to speak. So you're able to then see flexibility from that point of view. But it is very important, guys, because I think a lot of the time everyone says, when you squat, you have to squat, arse to grass, right? You need to, go all the way deep into the squat. But if you do a flexibility test and your clients are there, that's not to say that they cannot get to a deeper squat, but squatting deeper doesn't always yield more growth. Or squatting deeper doesn't always mean that it is a more effective squat. Depends on what you're trying to get out of the squat. If you look at a sprinter, right, like Usain Bolt, do you think Usain Bolt is focused on squatting arse to grass? Probably not, no. Why? Because he just needs short bursts of energy, right? It's probably good from a flexibility point of view for him to train some form of a squat that is deeper. But in terms of load, in terms of when he's training in the gym, he probably is doing anything from a quarter to a half to, a 90-degree squat. So anything from 45 degrees to 60 to 90 degrees. Why? He's more focused on explosive power, right? He wants to be able to put his muscular load there and have his muscles fire off of that, right? Does that make sense? You want to load the muscle and then focus on that explosion. Then that is what you want to look at. Whereas let's say you have a prop. Let's say you have a springbok or something like that. Maybe you want him to be in slightly more bigger range of motions, but maybe not. Because if you think about a prop, do they really go past 90 degrees when they play? Probably not. In most cases, probably not. They're probably reaching 90 degrees when they're in a scrum or when they're tackling. But you're probably not seeing, we're not seeing Kitsoff, or we're not seeing Bongi or Ox or Malcolm or any of them. We're not seeing them sitting in the lower squat position on the field like, hey, how's it, guys? How low can you go? Right? So it's also individual specific. Whereas when you look at it from a hypertrophic point of view, you have to work with what that individual has. If that individual loses all sense of structural integrity, all sense of go forward, and all sense of efficiency when squatting, right? And you want them to keep going lower and lower, but their structural integrity and their efficiency of completing the movement isn't there. Is there really much benefit you're getting from going deeper? Probably not, no. But it does give you an indication on flexibility, right? The same as with like a bench press, the same as with like shoulders or legs or whatnot. A strong muscle is a flexible muscle, or a flexible muscle is a strong muscle. But to get to that point, you need to be able to make sure that you improve your range of motion and your movements and stuff like that. That's why if you look at posing, if anyone follows bodybuilding here, back in the day, Arnold used to do ballet. Arnold used to do ballet. And why he used to do ballet is, of course, as you put more muscle size on, your range of motion, because muscles get in the way of being able to move. But he used to do ballet to get used to opening up his shoulder, being able to do that, opening up his quads and his legs and being able to activate them effectively. And also, might I add, from what I hear, not that I've ever participated, but I believe ballet is also incredibly difficult, right? So there's also a strength component there as well. But it just shows from a flexibility point of view that even individuals who are looking at being the most muscular on the face of the earth, how they pay attention to flexibility. So it's not just for like being able to say to your clients, hey, look at me, this is what we're going to be doing today, this is what I want you to be able to do, etc., etc. There's also a point behind functionality. Is everyone in agreement? Oh, bananas. Agility, right? Agility. Look at us go. We want to be agile, We want to be able to get going. Sorry, we just have a question here. From what you said about the sit and reach test, seems like one can still do a sit and reach test without using the box that is usually used. Yes, of course. You can set it up in the gym. I just said that some gyms have it. Doesn't mean all of them don't. So you'll see in your textbook, it will be nicely laid out, but you'll have a marker that you lay. Let's call that a ruler, right? You're going to put a ruler in between your client's legs because they're going to lean forward, right? And you're going to see where that starts. You're going to put the ruler there. From there, you're going to take the tape measure and you're going to attach it to the ruler and you're going to take it out, almost like you're creating a T, right? So if this is the ruler and here's your tape measure, you're then going to measure how far along the tape measure do they sit and reach. And then you're going to have your distance. All good, Emmanuel? Cool. Now, agility, right? Now, agility is a measure of how quickly direction can be changed without losing balance. It can be seen as a key component in offensive and defensive play. Performance in agility depends on a number of factors such as strength, flexibility, power, reaction time, etc. So here you can do a 20-yard or an 18.3-meter shuttle test. So agility can be assessed during the 20-yard shuttle test. The tester needs to lay out 3 vertical lines, so 5 yards apart. On a sports field, the client starts at the center line in the 3-point stance position. On an auditory signal, the client sprints to the line in front of him or her, touches the line with their foot, and turns around and sprints all the way to the farthest line. Touches that line with their foot, then turns around and sprints all the way to the center line. Then the time is stopped when the center line is touched by the first foot to contact after the full circuit has been completed. The faster of the 2 trials is recorded to the nearest second. So here we're just thinking of like doing a shuttle test, right? You're placing 3 cones, 1, 2, 3. You start, you're running back, running back, and then when they get back, you cut the time or whatever the endpoint is, right? And you want to see how fast can they change direction, right? Now, when you look at this, there's going to be various different tests. Again, guys, space is probably going to be a limiting factor. Unless maybe your gym has a parking lot and you're able to quickly go outside and quickly do it in the parking lot. But then again, you know, how many people are going to feel comfortable to leave the gym and then go? Emmanuel, is everyone on the agility side? Emmanuel, we did have this issue earlier. Maybe if you just try and refresh, Miller did have a suggestion earlier. He said if you press the sync to the live, I'm not sure, or if you just try and reset or refresh. If it is a network problem, don't worry, Emmanuel. This is being recorded, so you will be able to catch up on it at a later point. Right. Then we also have like the T-test. I'm sure all of us have done a T-test before. The cones are laid in a T shape. The subject starts at cone 1 and run forward to cone 2, placed 10 meters away. The subject must touch the cone with both hands and then shuffle sideways towards cone 3, which is to the left. And then subject may not cross legs while shuffling and must touch the cone with one hand. And then on reaching it, the subject is to shuffle right towards the cone to cone 4 and touch it. The subject must shuffle back towards cone 2, which is to be touched finally, and then the subject must run backwards towards the starting position. Should the subject cross legs while shuffling, he or she should immediately be disqualified. The subject may have 3 chances with the best time being wrong. Right. We're not trying to do what's it called, the Coca-Cola. You know, when you do your legs like this, we want to see how fast can you shuffle. And back, right? Run forward, side, middle, back, right? Simple as, right? This really isn't higher level maths, right? We're not trying to see, of course, you know, have you guys ever, are there any NFL fans here? Does anyone watch American football, right? Anyone watch American football? Has anyone watched any American football movies? Okay. Does anyone know what the NFL Combine is? So the Combine is a group of tests that they do before the season. It's when a lot of the college players get a run, you know, potentially to be drafted to certain teams. And what they do is they just do a ton of tests. They do a 40-yard dash test. They do catching tests. They do strength tests. They do, you name it, right? And when you look at all of this, agility tests are not meant to be these long processes. We want to see how quickly people can change direction, what they're doing, how you want to do it, etc. Now, the point being is that when you think of doing this, you know, this is to try and make it as easy to do for your clients as possible, right? You just want to see how quickly they can react. We're not here to try and set up, you know, like we're playing Maze Runner or something like this, and we're trying to get them to escape a labyrinth of some sort. And, you know, we just want to see how fast can they change direction. Now, granted, there's lots of other tests that we can do, but you just want to be able to put yourself in the ballpark of what is best for your client. Okay. Now, agility, we also have the hexagon test. So the hexagon test is an agility test that requires the client to jump over the 6 sides of the hexagon 3 times in a clockwise direction. The hexagon sides are 61 centimeters in length and form 120-degree angles. The athlete starts in the center, and on an auditory command starts a test. The time is stopped when all 18 jumps have been completed. The client is given 3 trials, of which the best time is recorded to the nearest 0.1 second. The test is stopped if the client loses balance or fails to jump over one of the sides of the hexagon. Does that make sense to everyone? Does that make sense? So it's just a little hexagon test. You jump, seeing how quickly you can change direction. You can also, if you are in a gym setting, and you're able to go into one of the studios, you probably can set up cones in there or little markers, and you can have them start in the middle and you can have them run forward to a cone. And you can set up 6 cones in like a hexagon like that, and you can say, right, go forward, go back, go left, go right. And each time they have to go back to the center, and then you can start to play a game, and you can be like, okay, cool. You give them a pattern, so forward, back, left, right, and or top, right, top, left, you know what I mean? Or bottom, left, bottom, right. And then you can start to be like, start in the middle, and then you call at a command where they're meant to go. And then you can start to see how quickly they change direction then. So then you can say, for example, bottom left, go. Bottom right, go. You know, and then see how they react. So you can also gauge it, you know, going forward. Yes.
I'm not sure what you call those. Is it ladders on the ground that you do the steps or something? I think. Are those also like agility tests?
That would probably be more focused around speed. But it is something that you probably could use. You could set it up in terms of probably the poles are probably more for agility, being able to move between the poles.
Yeah.
And you can use that. Look, agility, you could use it in the sense that, you know, when if you use the ladders, instead of just running straight through them, but you're going left to right, left to right, left to right, left to right, you could also do that. Again, spacing is probably going to be the biggest limiting factor that you're probably going to encourage with these tests. Okay. And what is the one thing, ladies and gentlemen, that we have not discussed today, which will be incredibly important for your clients when it comes to setting these tests up? What is the one thing that we haven't discussed today? Can everyone give me a little inkling, a little idea of what we think that is?
Cool down and warm up.
Roberts, welcome. Welcome. Yes. Cool down and warm up. Right, guys, this is the last thing for today in terms of cool down and warm up. Guys, if these people have never been in a gym, or even if they have been in a gym, you want them warmed up before they're doing these tests. We want them to be as warmed up as possible so that we can get the best test out of them as possible, especially if you're doing some of the 1 rep max stuff. Could you imagine? Just put yourself in that position. Let's say your 1 rep max is 3 or 4 plates on a back squat, and you don't even do a warm up set, and someone's just like, hoorah, give me 1 rep. Your knees are not going to be very kind. They're not going to be very gracious with that load that you're going to have. So we need to warm people up. We need to make sure that they are warm, that you just want to mitigate as much injury as possible. But then after doing a lot of these tests, often you're moving the body in a direction that not everyone trains for. Not everyone is used to putting themselves in that position. So then you're just going to have to do an element of a cool down. You know, let them walk slowly on a treadmill. Let them do something, stretch, feel mobility. And yes, I'm pretty sure we all do an element of warming up, but I'm sure we can all agree that we are probably all equally bad at doing cool downs, right? Because normally when we're done gym, the gym's been busy, you want to get home and you're just so tired or full of just like being in the gym, and you're just like, I just want to get home now. Okay? But do not underestimate the importance of the cool down. Arguably, in some cases, it's probably more important than a warm up.
Or hungry.
Right? Or hungry, yes, or hungry. Yeah, you're not wrong. Or we still need to go past the shop. It's that one thing that we forgot to get, that we promised we wouldn't forget to get, and then inadvertently we did forget to get, and then now we need to get it on the way back. And then, you know, Spar or Pick and Pay or Woolies is going to close, and heaven forbid we don't get that thing. So I'm only trying to make a plan for a plan for a plan. Yeah, you know, we've all been there. But the point being is that cooling down is incredibly important. And that's where, depending on what gym you go to, there's also various methods of, you can use a sauna. You can use, if you are one for an ice bath, or if you have a pool, you can always just go and do a couple of lengths in the pool, just nice and slow, just getting the body moving. Or like I said, just a nice slow cycle or a slow walk on the treadmill, just to lower the heart rate, and then do a little bit of stretching if need be. But that is pretty much what you've done today, guys. Okay? Now, when you look at all of this, there's a lot of information here. There's a lot of testing. You know, when we started with the heart rate, to the blood pressure, to the posture, right? Then you look at, for example, your baseline testings, you know, your body composition testings. Right? What are we going to do from body composition? Are you going to do more BMI? Are you going to do waist to hip ratio? Are you going to do girth? What are you thinking of, like in your head? What are you thinking? Then we have these testings. Are you going to do speed? Are you going to do agility? Are you going to do power? Are you going to do flexibility? Are you going to do speed? I think I mentioned speed already, but the point being is that there's all these different tests. Strength, you don't have to do all of them. You got to look at the time available for doing testing. Maybe you're not giving a full hour. Maybe you're giving half an hour, So you need to be able to look at that and think about it. Like, yes, it's great, but how long is it going to take you to set things up? How long is it going to take you to do it? So you got to just think nicely to yourself about that. As I said in the beginning, a lot of these initial assessments are done free of charge. I'm not saying that you have to. You can do whatever you like. If you want to charge the individual for that, I mean, they are getting valuable information. I mean, like, if you're not feeling well and you go to the doctor and the doctor's like, you're fine, but I'll write you a script for some over-the-counter meds, which you can effectively probably walk into Dis-Chem and get. You still pay that bill, don't you? You still pay, the doctor his or her fee. So, I mean, if you don't want to charge, cool beans, power to you. But some people tend to do this more for free as like a faith of goodwill, in hopes of securing the client and moving forward. But you got to be able to trust yourself with what is the most important thing for you, because when you have such a small period of time, you can't be there thinking, what was that test again? How do I set it up? Sorry, let me consult my textbook. Let me quickly Google. Oh, damn it, I don't have cones. You got to look at this and see. Now, granted, in the modern day way of doing it with online coaching and stuff like that, like, let's be real. If you are an online coach and you're growing an online profession like that, it's going to be very difficult for your online client to buy into doing these tests, because what are they going to do? Go to the gym and set it up for themselves and record for you at the gym? Probably not. So, we are also in a day and age where testing is slowly probably not being given the credit it's probably deserving of. But in that same breath, hey, I mean, like, if you're coaching someone on the other side of the world, I mean, like, you got to do what you got to do, isn't it? So, there are different ways. You can ask them in your initial screening. You can ask them, hey, please, can you give me your blood pressure? Can you give me your heart rate? Can you, when they do their check-ins, you can be like, hey, can I just check your blood pressure every day? Can you record it every day for me? And at the end of the week, just send me a photo of what you've recorded. There are ways to get around it, right? And there are ways you can slowly progress. You can start them with like, okay, cool. What I want you to do is do this program for a week. I want you to see what weight you get to that reaches 8 or 12 reps for 4 sets. What weight gets you to failure? And then you can take that and then you can build from there. And you can be like, okay, cool. Well, that's approximately 40 kilograms. So we're going to do 40 kilograms for the next 2 weeks. And then we're going to move up. You know what I mean? Like, there's ways in which you can work around it. But that is the case. Are there any questions, ladies and gentlemen? You guys have been an awfully quiet bunch today. But if there are any questions, please do ask them now. Is there anything you guys want me to go back over? Is there any questions you have? Please feel free to ask.
Hello. Hello, Cameron.
How's it, Emmanuel? How are you?
I'm all right. My apologies for joining a bit late. But I just wanted to, you did mention the slide will be, the recording will be shared. Perhaps it will help to catch up as well.
Yeah.
All right. Well, thanks a lot.
Yeah. They are on YouTube as well.
All right.
Yes.
Okay, cool.
Thanks. Yeah.
I think you did answer. I was going to ask about the 11th of October workshop. Is it also on YouTube?
Yeah. I'll put that up.
Okay, thanks.
That's the one where you arrived a little bit later. You had connectivity difficulties. You arrived further towards the end. Oh, okay. Okay.
I don't remember.
Okay, no worries. Yes, it is on YouTube. It's on YouTube. That shows. Any other questions, guys? Any of the new people? No questions? All right, then. Well, what I'm going to do, I'm going to stop the recording now. Thank you all. Stop the recording.